I feel like both healthcare professionals and sickle cell warriors need to hear this. Giving strong opioids for sickle cell crisis pain is an appropriate use of opioids, and there's no need for you to feel like you're fueling some kind of imaginary drug habit. I have sickle cell and I've been a medical doctor for 12 years, so I want to make sure everyone is on the same page here. Let's imagine for a second that you are set on fire. Your whole body is ablaze, burning, and you run to a fire station to ask for help. And instead of blasting you with a water hose to put out the fire immediately, the fireman thinks to himself, you don't look like you're on fire. I'm not 100% sure that you are on fire. I think that you might just like being sprayed with cold water a little bit too much. You see where I'm going with this? So he takes a thimble of water and throws it on you and says, let's start with a few thimbles and see how you get on first. The fireman's thinking, great, they're not getting one over on me if they're a drug addict. And if they're not a drug addict, then I'm saving them from becoming one. Because there's no way that they could actually be set on fire as much as they say they are to the point of needing blasting with water. This metaphor is the mindset of healthcare professionals that I've experienced in hospital as a sickle cell patient. And the thing is, because of the opioid epidemic, doctors have overcorrected. They're so hypersensitive about being seen as drug enablers that they undertreat sickle cell crisis pain. You know, God forbid someone in excruciating pain experiences a little bit of euphoria. You know, we can't allow it. They'll become a druggie. Why? Why do you have to think that? No one is chasing this high that you're so worried about. They literally just want the fire to be put out. You have no idea how that immediate short relief can help the body settle. It calms the nervous system. It reduces suffering. And it allows the person to then start to recover. Sickle cell warriors don't want to be dependent on drugs. We just want the pain gone so that we can get on with our lives. The stigma around opioids makes access to proper pain relief one of the most frustrating parts of living with sickle cell. But opioids, when prescribed and monitored, are safe and effective, and sometimes the only thing standing between a warrior and unbearable suffering. So please, if you're working with sickle cell patients, I hope this helps you empathize a little bit more when it comes to giving appropriate pain relief. I talk more about the stigma behind opioids and appropriate use of opioids in my new book, Sickle Cell Treatment Guide. If you're interested, check the link in my bio. It's on discount until the end of September.